All right, hello everyone. Thanks so much, Jamil, and to the McPeak-Sirois group for organizing this really wonderful event about a very important topic, artificial intelligence. So I don't speak French, but I think Dr. Asala introduced me. I'm Akasha Jerzak. I'm a breast medical oncologist at Sunnybrook Odette Cancer Center, which is affiliated with the University of Toronto. And we, I believe, are the most recent center to join the McPeak-Sirois consortium. We're very excited to participate in the network for clinical trials and maybe even collaborate on some of these very innovative projects that are ongoing related to AI. I'll take a couple of minutes just to give examples of two projects that we're doing at Sunnybrook Odette Cancer Center related to artificial intelligence and breast cancer, and I've had the privilege to be involved in both of them. So the first project is related to early breast cancer. Okay, so when patients initially get diagnosed with breast cancer based on a biopsy and imaging findings, they come to clinic, and as the medical oncologists in the group know, we often have sort of cookie-cutter approaches to how we treat patients. So for example, if a patient comes in with a relatively large triple-negative breast cancer, with or without lymph node involvement, we have a standard approach with multi-agent chemotherapy and immunotherapy, which in that case, actually, in that example, lasts 6 months. So it's pretty tough chemotherapy to get through, very effective, but does have some toxicity. Wouldn't it be great if we were able to develop a biomarker to tell us ahead of time, a priori, which patients really need this sort of, multi-agent treatment with immunotherapy, and maybe which patients could benefit from a de-escalated approach, with gentler chemotherapy, for example, in combination with immunotherapy. And historically, when we set out to do these types of biomarker projects, we would look at sort of the pathology report, look at findings on the imaging and findings in the clinical chart. But now, with artificial intelligence, this has really unlocked completely new data sources that we can use. So for example, rather than just looking at the pathology report, we can look in more detail at the actual tissue. What is the architecture of the breast cancer? What are the different types of immune cells that are infiltrating that breast cancer? What about the tumor microenvironment? The structure of that we know is important too. And above and beyond all of this, we also have data and images. So the mammogram, the ultrasound, the MRI. So at Sunnybrook, a scientist named Dr. Anne Martel is compiling all of this rich data. So the pathomics, the radiomics, and then all the standard clinical pathologic features together to develop algorithms to really predict response to chemotherapy for patients with breast cancer and predict who might have a relapse down the line. And another example, this is a bit of a shorter example I want to mention because, at the other end of the spectrum for patients with metastatic breast cancer, there is a big problem of brain metastases. About a third to up to 1/2 of patients with the most aggressive forms of breast cancer, so triple negative or HER2 positive disease, will develop brain metastases. And I think, this is a big problem because brain metastasis can cause neurologic problems, and they're known to shorten people's lifespan. The problem is that as medical oncologists, we're often treating these patients in the blind. I don't know what the molecular subtype is of those brain metastases, because in order to get that information, we have to send those patients to the operating room to either have that brain metastasis removed or to do a brain biopsy. And clearly this is not a standard or a very easy procedure to do. So what we're doing at Sunnybrook, I have a very talented fellow. His name is Dr. Mark Freeman. He happens to have a mathematics degree from Harvard, which can't hurt in this sort of scenario. And we're working together with our imaging scientists to look at the MRI images of the brain to try to predict the molecular nature of the brain metastases so that we can better personalize therapy for patients in the future. So those are just two examples. Thank you so much for the opportunity to share that and for the opportunity to hear about the other innovative work. I think it's really fantastic to have like-minded individuals under one roof, and I'm certain this is going to lead to more collaborations, not only within Quebec, but also with Ontario as well. So thanks again.